Hey, this is Don Walters coming to you from TheClinicalTrialsGuru.com. Again, that website is www.TheClinicalTrialsGuru.com. Hey, listen, Dan and I were watching this video that we found on YouTube, and there was a young lady by the name of Lynn Gannett. I hope I'm pronouncing that right. It's G-A-N-N-E-T. And Lynn was speaking at the Harlem AIDS Forum. And I'm not sure how old this video is. I'm guessing it's recently. But Lynn was sharing some information that to me was very disturbing. Lynn apparently had worked at a research site there in New York. And apparently there are doctors and nurses that are bypassing protocol and ignoring complaints by patients that are in that study. And these complaints are complaints that could be listed in clinical studies of what we refer to as adverse events, which means that, or serious adverse events, because they were complaining about being sick, not doing well on the study medication, complaining about different complications that needed to be looked at. Listening to her talk, according to Lynn, she felt that these doctors and whoever was running these clinical studies were putting the patient's health below the dollar, and that's wrong. You should never, ever put the dollar or anything else in front of patient care. Patient care is number one. Even though you're in research, we're not a medical center, but we still have to be concerned about that patient's health. That's always number one, coming in the door and leaving the door at all times. If you're in business, and this is a business, if you're doing it right and managing your studies, the dollars are going to come, just like any other business. If you manage your business right, the dollars will come. You don't need to cut those kind of corners that put people's health in jeopardy. Now, again, like I said, there are protocols, as Lynn had indicated, that are in place to tell you how to deal with these things. And what she was saying is that these doctors and nurses ignore the protocol. There are protocols in place to teach you how to, that directs you on exactly what to do if you're running into these type of events. If someone's complaining of negative responses to the medication or they're getting sick, whatever that situation may be, there are protocols in place to tell you exactly how to handle that, how to report it, and how to follow up. And apparently that wasn't being done. I guess they were trying to hang on to that patient and see them through the study till the end so that they can get paid for the visits, and that's wrong. And that also, that kind of stuff as a black mark on research, and I don't like that. Okay? And we have an old saying, excuse me for what I'm about to say, and that's called urinating in the well that the rest of us drink from. And I don't like that. Now, if you're somebody that is looking at participating in a study, or you're in a study and you run into a situation like that and you're complaining about the symptoms and you're not feeling well, you're feeling sick as a result of the study medication, and no one's listening, then what you need to do is go back to that. You should have a copy of that informed consent that you first signed. It's like an agreement when you come into the study. On that, there's what's called the IRB, and it'll be those acronyms. And there should be a phone number listed under that IRB of who you can call. And you can always call someone at that IRB and let them know what's going on, so that you don't have to put yourself at risk. Now, I'm not saying to call them for every little thing that goes on. You have to approach the doctor, approach the nurse, or whoever's there, the coordinators, and let them know what's taking place and how you feel and what's going on. And on the reverse side, if you're running a study, it goes back to what we talked about before, is getting to know your client too and talking to them off the record sometimes. Sometimes just pulling them aside and saying, how are you doing? How's things working out? You know, and if you got to buddy up sometimes with your clients in a sense, and I don't mean become best friend, but I mean buddy up to get them to relax and tell you what's going on. Because all of us, when we walk into a medical office to see a doctor, we all kind of get a little nervous. And we always don't tell what's going on. And that can be the same situation here. That information is for those people who are conducting the studies that are right way. But for those who are trying to bypass protocol so they can make dollars, shame on you. I don't like that. That's bad, because that hurts the rest of us. And as I said again, you're urinating in the well that we drink from. And again, if you're a patient that's in a study and you're suffering complications and no one's listening to you and you're trying to get their attention, then look on that agreement. If you don't have it, ask to see it. Tell them you want a copy of it, get that IRB number off of there, and call. Again, I hope this helps somebody out there. And again, I found this to be deplorable if they are doing this for the dollar bill. Anyway, this is Don. I'm signing off from The Clinical Trials Guru. And again, that's www.theclinicaltrialsguru.com. Thank you.